I've always been interested in prevention. As a family practitioner, that's the definition of what we do. We take care of all age groups, and we try to prevent catastrophes and crises. And what I found is my 2 hours of education in medical school really didn't prepare me, so I had to do my own studying. And then my patients, who constantly bring in articles upon articles from all the prevention magazines that are out there in the shelves, really forced me to even do more research because they wanted my recommendations. And what I used to do is say, go to your pharmacy and get a name brand supplement, and that should be fine, until I realized that I really wasn't giving them any more advice than they can get from a throwaway journal. So what I did is I studied, and I found that the company that we're talking about, Pharmanex, had a supplement that had science behind it. And if it's going to be proven, if it's going to meet my criteria, it's going to have science backing it. And so I did my own due diligence. I actually went out to the company and looked at the lab. I looked at the distribution center. I looked at the process that Dr. Chang discussed through standardization and the safety that went into this. And I had a conversation with Dr. Chang once, and I said, what is the most important thing that would allow me to feel comfortable with the supplements that your company makes? And he said, safety. And I knew right there, it reminded me of the first day of medical school when they said, do no harm. That was critical to me. I had to make sure that there was safety in the supplements that I was recommending. Not only that, but I needed to have a way to validate what the patients were doing. And in was the biophotonic scanner is a perfect example of that device. So, it's been very interesting the last 3.5 years that I've had my patients using the LifePak Nano and other Pharmanex supplements. I've seen several changes in them. I've seen not only their scores go up, but as a physician, anecdotally, I see chronic illnesses. And understanding that as a supplement company, there is no way that we can state that we change the way illnesses occur. But as a physician, I see that the amount of health in my practice has reached an all-new level. And my patients come in, and I had a gentleman come in the other day, and he said, I don't know why I'm taking this supplement, Dr. Rosenberg. It's been 2 years. And then he turned to me and he said, you know what? I haven't felt better in my life. And this gentleman's 84 years old. These stories come in every day. But what made most sense to me is not the stories, but it was the science to back it so I would feel safe. And there was another interesting thing that happened 3.5 years ago. As I was trying to improve the health of my patients, my son started going to college. And the way the economy was treating health care over the last decade and the way tuition was going up significantly, I needed another source of revenue. And having run a free clinic for 10 years, I know how important it is to have money to run an organization, not to mention to run my practice. Well, with the added expense, the realities of college tuition for my first child and then my second and now my third in the next few years, the revenue from this program was substantial. And now I call my son's degree actually the Caltech Pharmanex degree. And it's kind of interesting because now that I've improved the health of my practice and my son has graduated, I can then think of the income I get as helping me towards retirement so that one day I'll have the true joy, which is to practice medicine for free to people who truly can't afford it more than I do now. And to me, that's going to be fun. And Pharmanex is helping me to do that. So I want to thank you, and I plan on coming back and telling you more stories of successes that I've had.